Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A client has been diagnosed with avoidant personality disorder. He reports loneliness, but has fears about making friends. He also reports anxiety about being rejected by others. In designing a long-term treatment plan, in what order, from first to last, should the nurse include the following? 1. Teach the client anxiety management and social skills. 2. Ask the client to join one of his chosen activities with the nurse and 2 other clients. 3. Talk with the client about his self-esteem and his fears. 4. Help the client make a list of small group activities at the center he would find interesting. The correct order is 3, 1, 4, and 2. The client needs a stepwise plan for developing a social life. He needs to first work on his self-esteem and reduce his fears of rejection before talking about how to decrease his anxiety and learning new social skills. Helping him choose interesting activities is important before suggesting an activity for him. Then he will be ready to try a structured activity with the nurse present for support and role modeling. The nurse manager of a psychiatric unit notices that one of the nurses commonly avoids a 75-year-old client's company. Which of the following factors should the nurse manager identify as being the most likely cause of this nurse's discomfort with older clients? 1. Fears and conflicts about aging. 2. Dislike of physical contact with older people. 3. A desire to be surrounded by beauty and youth. 4. Recent experiences with her mother's elderly friends. The correct answer is 1. The most common reason for the nurse's discomfort with elderly clients is that she has not examined her own fears and conflict about aging. Until nurses resolve their fears, it is unlikely that they will feel comfortable with elderly clients. A dislike of physical contact with older people, a desire to be surrounded by beauty and youth, and recent experiences with a parent's elderly friends are possible explanations, but not common or likely. A nurse is planning care for an elderly client with cognitive impairment who is still living at home. Which action should the nurse identify as a priority for safety in planning care for this client? 1. Having 2 people accompany the client whenever the client is up and about. 2. Ensuring the removal of objects in the client's path that may cause him to trip. 3. Putting the client's favorite belongings in a safe place so that he will not lose them. 4. Giving the client his medications in liquid form to make certain that he swallows them. The correct answer is 2. When caring for a client with cognitive impairment, the priority is to ensure that all objects in the client's path are removed to prevent the client from falling. Additional measures, such as having 2 people accompany the client when he ambulates, placing his favorite things in safekeeping, and giving medications in a liquid form to be sure he swallows them, are less crucial and available. When assessing an aggressive client, which of the following behaviors warrants the nurse's prompt reporting and use of safety precautions? 1. Crying when talking about his divorce. 2. Starting a petition to delay bedtime. 3. Declining attendance at a daily group therapy session. 4. Naming another client as his adversary. The correct answer is 4. The client exhibits aggression against his perceived adversary when he names another client as his adversary. The staff will need to watch him carefully for signs of impending violent behavior that may injure others. Cry about a divorce would be appropriate, not pathologic, behavior demonstrating grief over a loss. A petition to delay bedtime would be a positive, direct action aimed at a bothersome situation. Although declining to attend group therapy needs follow-up, there may be any number of unknown reasons for this action. When developing a teaching plan for the community about managed care models and their effect on clients with chronic mental illnesses, which of the following factors should the nurse include as detrimental to this population? Select all that apply. 1. Restriction in the range and quantity of services. 2. Hospitalization reserved for emergency services. 3. Non-shifting of funding to outpatient services when clients are moved to these services. 4. Loss of the principle of least restrictive alternative for care. 5. Lack of sufficient numbers of group homes and supervised apartments. The correct answers are 1 and 3. Without a sufficient range and quantity of services, care is inadequate and hospitalization rates increase. Non-shifting of allocated funding to outpatient services has increased the problem with the range and quantity of services. Reserving hospitalization for emergency services was a practice before managed care. The principle of least restrictive alternative is still as relevant as it was before managed care. There are not enough group homes available. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A client reports having blurred vision after 4 days of taking haloperidol 1 milligram twice a day and benztropine 2 milligrams twice a day. The nurse contacts the primary healthcare provider to explain the situation, background, and assessment and make a recommendation. Which information reported to the primary healthcare provider is the assessment of the situation. 1. Mr. Roberts is taking 1 milligram of Haldol twice a day and Cogentin 2 milligrams twice a day. 2. I think Mr. Roberts might need a lower dose of Cogentin. 3. Mr. Roberts reports having blurred vision since this morning. 4. The higher dose of Cogentin could be causing Mr. Roberts' blurred vision. The correct answer is 4. Cogentin has a common side effect of blurred vision. After evaluating the relative doses of Haldol and Cogentin, the assessment would be that the higher dose of Cogentin compared to the dose of Haldol is responsible for the blurred vision. High doses of Haldol can cause blurred vision at times. Reporting that Mr. Roberts has blurred vision is the situation. Listing the medications and doses is describing the background. The recommendation would be a lower dose of Cogentin. An elderly client who has been diagnosed with delusional disorder for many years is exhibiting early symptoms of dementia. His daughter lives with him to help him manage daily activities, and he attends a daycare program for seniors during the week while she works. A nurse at the daycare center hears him say, "If my neighbor puts up a fence, I'll blow him away. He has never respected my property line, and I've had it." Which of the following actions should the nurse take? 1. Observe the client more closely, but do not report his threat, since he will likely not be able to follow through with it because of his dementia. 2. Report the comment to the client's daughter, so she can observe him more closely, but refrain from telling the neighbor due to privacy regulations. 3. Report the comment to the neighbor, the intended victim, but refrain from telling the daughter since she will just worry about actions of her father she cannot control. 4. Report the comment to the neighbor, the daughter, and the police since there is a potential for a criminal act. The correct answer is 4. The neighbor could be harmed as well as the daughter if she should try to stop her father, so both should be notified. The nurse has a legal/ethical responsibility to warn potential victims and other involved parties, as well as law enforcement authorities, when one person makes a threat against another person. This duty supersedes confidentiality statutes. Failure to do so and to document it can result in civil penalties. The client's early dementia would likely not prevent him from carrying through his threat. When providing family education for those who have a relative with Alzheimer's disease about minimizing stress, which of the following suggestions is most relevant? 1. Allow the client to go to bed 4 to 5 times during the day. 2. Test the cognitive functioning of the client several times a day. 3. Provide reality orientation, even if the memory loss is severe. 4. Maintain consistency in environment, routine, and caregivers. The correct answer is 4. Change increases stress. Therefore, the most important and relevant suggestion is to maintain consistency in the client's environment, routine, and caregivers. Although rest periods are important, going to bed interferes with the sleep-wake cycle. Rest in a recliner chair is more useful. Testing cognitive functioning and reality orientation are not likely to be successful and may increase stress if memory loss is severe. The nurse is making a home visit with a client diagnosed with Alzheimer's disease. The client recently started on lorazepam due to increased anxiety. The nurse is cautioning the family about the use of lorazepam. The nurse should instruct the family to report which of the following significant side effects to the healthcare provider? 1. Paradoxical excitement. 2. Headache. 3. Slowing of reflexes. 4. Fatigue. The correct answer is 1. Although all of the side effects listed are possible with lorazepam, paradoxical excitement is cause for immediate discontinuation of the medication. Paradoxical excitement is the opposite reaction to lorazepam than is expected. The other side effects tend to be minor and usually are transient. The primary healthcare provider prescribes risperidone for a client with Alzheimer's disease. The nurse anticipates administering this medication to help decrease which of the following behaviors? 1. Sleep disturbances. 2. Concomitant depression. 3. Agitation and assaultiveness. 4. Confusion and withdrawal. The correct answer is 3. Antipsychotics are most effective with agitation and assaultiveness. Antipsychotics have little effect on sleep disturbances, concomitant depression, or confusion and withdrawal. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.